Good morning. It is a great pleasure to be here in Paris at this prestigious World Congress to present a new laser treatment for the iris and the IRIENSZ Workstation with which we carry out this procedure. This conference presents long-term results of 7 years of technological research and development and the corresponding clinical trials. I will begin with a brief introduction of the options that we have today to treat eye cosmetic disorders. In the first place, the most common are cosmetic contact lenses, which offer all kinds of colors, although their appearance is really artificial. As permanent surgical solutions, I will discuss two main techniques. The first is the cosmetic intraocular lenses that began to be used years ago to treat congenital iris anomalies, such as coloboma and aniridia, and secondary to trauma and complicated surgeries. The most popular classic brands of cosmetic intraocular lenses have been Ophtec, Morker and Dr. Smith's, although lately Bright Ocular has marketed large anterior chamber lenses. And the second technique is the keratopigmentation for the corneal treatment for both congenital and acquired opacities. It is a surgical technique with two modalities, one manual and the other assisted with femtosecond laser, and in which a biological dye of different shades is injected into a circular corneal channel. Both don't seem trustworthy since they present many and serious complications that can cause even the loss of vision, especially the intraocular lenses with support on the cameral angle. Please take care. With regard to the pigment disorders of the iris, we are going to present a new technique that is laser iridoplasty, with which we already have 7 years of experience. As a brief introduction, say that the melanin is a protection against UV rays, but also performs a physical, chemical and biological protection. There are two main types, the brown melanin called eumelanin and the yellowish one called pheomelanin. In the posterior layer of the iris, only eumelanin is found, and therefore the iris color will depend on the type of pigment and the size of the intracellular granules, since the percentage of melanocyte is always the same and around the 65%. Here we can see an histological section in which we notice the very thick and dark posterior layer with eumelanin and the stroma and the very thin anterior layer in which eumelanin and pheomelanin granules are scattered as the debris. The main pathological indication of laser cosmetic iridoplasty are heterochromia, congenital or secondary to serum of eyelashes growth, glaucoma eye drops, metabolic diseases, traumas, complicated eye surgeries, and benign tumors called nevus. Here we can see several examples of heterochromia, one secondary to complicated surgery, in the center a congenital case, partial or iridis, and complete or iridium. To the right above we can see a dark case secondary to a cataract surgery in the childhood and down already treated with laser. Now we see on the left a case of a single large nevus, and on the right another congenital heterochromia on the left eye. Above before the treatment and below with the final appearance very similar to the right. But we could ask why laser iridoplasty was not done before, and the answer is easy, each strength difficulty. If we compare the laser iris treatment with the excimer laser on the cornea, we will quickly understand the level of complexity. Regarding the surface, we find a very irregular cornea but an irregular iris. The corneal thickness is very constant, but in the iris is completely variable. The density of the corneal tissue is quite irregular, but in the iris is very different. The cornea is colorless and the iris can contain several colors, even in the same patient. In the cornea there are no key structures, but in the iris we find vessels, nerves, collagen and muscle fibers, and the cornea is an unstable structure, but the iris is always moving. And finally, the access to the cornea is directed by the excimer laser, but the iris is into the eye. For all these reasons, it is easily understandable that we faced an important challenge, which will involve a lot of work and the need to keep calm. Although sometimes the difficulties became bigger and bigger. In order to reach our goals, we set out 3 phases of research. In the first, we would approach the main, safety and efficacy. Regarding safety, we carry out vision and pressure controls that seem perfectly correlated. In every session, the pressure went up in the same way that the vision went down, but both quickly recover. In the same medium and long term, both pressure and vision remain normal. With OCT, we saw how the stroma and the posterior epithelium kept undamaged. Neither the cornea showed alterations after the treatment. By specular microscopy, we calculated density, heterogeneity, and hexagonality indexes of the cornea endothelium and were similar before and after the laser. Finally, Goldman gonioscopy showed a pigment increase in the lower angle, but temporary, and never in the middle and upper sides, thanks to the advice to keep heads up after each session. In the second phase, from 2014 to 2016, we introduced a new pigment classification and improved technology with prediction tools, new lasers, new equipment, and new medication as well. The challenges were confer the UV rays protection, reduce complications, better predict the results, and get an objective evaluation. For this, we carry out new histological, physiopathological, pharmacological, and fluid dynamic studies. We achieved new medical protocols, new software, new applications, genetic tests, and others. On the left, we can see the new pigment classifications into 4 degrees as melanin concentration. By tonometry and tonography studies before and after laser sessions, we better understood the anterior chamber and trabeculum fluid dynamics. New substances as low concentrated heparin improve pigment and debris clearance, and 5% alpha-arbutin help reducing the secondary melanin production, but not really enough. 1% apraclonidine, like in laser trabeculoplasty, avoid pressure raises after laser, and miotic and mydriatic drops manage pupil size before and after. Topical prostaglandins can turn iris forever from green and blue to dark brown in very few months due to a fast melanin production. Eyelashes lengthening serum contain prostaglandins, and glaucoma drops as well. In order to predict outcome, we developed a software and an app based on patient and parents' phenotype traits and the 2 genes law. The predictor app offers a probability of both color and tone of green, blue, and gray. Also, by this app, we can get an own simulation. A more objective prediction is reached by genes testing. Special probes can locate 5 alleles from saliva DNA. See on the left a typical report with 5 genes results. Homemade photo techniques were taught to patients to take high-quality pictures by smartphones in order to obtain well-focused, centered and well-lit photos, which can be sent by email to the clinic to check-up level. The first iris scanner model performed colorimetry, color contrast, thickness and 2D topography, and we set a new version to update pupillometry, physiodynamics and follow-up and segmentary studies as well. Here some images of first prototypes. An iris summary example with several maps, colorimetry, contrast, thickness and topography in 2 dimensions. Finally, we back to perform histological studies to check 4 new lasers with different wavelengths in order to improve both the results and reduce the complications. Third phase will end this year, 2018, and was set out to improve the whole technology, new software and apps, a new iris scanner version, and new lasers to approach as much as possible to excellence of technique. For example, iSelfie dramatically improved photo quality at home through an automatic mode guide by a voice assistant in several languages. Both eyes are saved in the phone and then sent by email to the clinic to study. A detailed analysis will be submitted to patient. Distance checkup and follow-up is greatly facilitated. Predictability has been also improved since second version app now covers dark eyes too, that we started treating mostly in 2018. News in 3D app performs outcome simulations before and after treatment, also checking the lighting and distance effect on color and pupil size. Last improved app was an automatic agenda. New iris scanner updates 2 new modules and a special software, anterior segment OCT and a tonometry and tonography module. New iris summary software greatly extends its functions to improve maps of colorimetry, color contrast, pachymetry, 3D topography and fluid dynamics. A new pressure formula, Goldman modified, incorporates density and viscosity of aqueous humor with a regression constant similarly to the classical SRK, so useful to dioptric calculation. "3D iris models are really helpful to understand and plan laser treatments. Finally, and very close to excellence, we can now define laser iridoplasty as a non-contact, bladeless, painless and step-by-step technique performed in the office on an outpatient basis. At my beginning, I was working on phaco surgery in sterile operating rooms. In a second stage on refractive surgery in laser rooms. Both specialties need specific workstations. And for the last 7 years, I have performed laser iridoplasty in my office with no strict sterility, without surgical pajamas or a mask. At a technical point of view, laser iridoplasty is a non-sterile procedure that needs an integrated laser system of 3 or even 4 wavelengths with pattern scanner, eye tracker and OCT modules to perform by routine customized treatments. Here the 5G laser with several integrated wavelengths, and on the right the planner software screen. We look forward to an automatic mode device similar to examine laser for refractive surgery, of course. New diagnostic and laser equipment will be mandatory to achieve this next level. Here, IRIÍZ Workstation that we currently use. I will now present clinical examples of results according to the protocols we have established. Main indication is heterochromia, here an heterochromia iridum, right eye light blue and left brown. And after the treatment with so similar eyes, as you can see. Here, same left eye large before and after the laser. A congenital large nevus, and on the right side another heterochromia iridum. Left eye was brown before and turned to green after the laser, largely matched with the right. A case secondary to traumatic surgery on the left, a partial heterochromia iridis in the middle, and to the right, a patient secondary to complicated cataract surgery of the childhood that changed to light. In the middle, a multinevus case, and to the right, a hyperpigmentation secondary to prostaglandin drug abuse. Full spots disappearance after the multinevus treatment is clearly appreciated. Cosmetic indications now are people that wish to change eye color simply. For example, a previously level 3, another grade 3 at the beginning with an obvious change after the treatment, a turquoise blue outcome with thin peripupillary crown left for safety reasons, to avoid touch the lens with the laser. Another grey blue example starting from a dark eye, a light grey blue result, a very nice result starting from a grade level 2. See here magnified the evident laser effect. In the center, the original brown pigmentation that completely disappear later. Two very clean final results with full absence of pupil crown, now possible with last generation lasers. As we see in these cases that no longer present any rest of melanin. Or this other one. One more perfect example, another one, and the last. Criteria admission must be very strict. Minor patients, psychological or psychiatric disturbance, drug or steroid abuse, and any chronic disease as self-immune have to be rejected. Personal and family glaucoma history, pressures upper 15, uveitis or iritis episodes, high refractive errors, and two dark eyes should not be accepted. In conclusion, in 2018, right now, cosmetic laser iridoplasty is a safe, effective and predictable technique with very low side effects rate and natural outcome always. Of course, additional longer-term studies are needed in the future. We see here clearly the laser effect. To end, a brief comment on the fourth phase that will start next year and will last 2 years. X-laser and in-laser will be the first full specific laser system for iridoplasty. specially designed to perform by routine custom treatments based on the scanner analysis.
Hi Doc, what I have to do?
Open your eyes and enjoy. Perfect. That's right.
Really? Awesome, Doc.
As you can see, a quick technique, painless, with instant and permanent effect, always natural and no long-term side effects. A new specialty named intraocular laser cosmetics has begun. Thank you very much for your kind attention.